So I'm with my patient Mike. Mike's been coming to me for a long time, but recently we had an episode of low back pain. After the MRI imaging, we determined that he had herniated disc at L5-S1. So spinal decompression was really the best treatment of choice. Nothing else is going to really fix a disc other than spinal decompression or spinal surgery. Surgery comes with a lot of risk, infection, failed back surgery syndrome. So decompression is actually non-invasive. It's painless, works great. Patients really like it. They fall asleep on the table. So we just did a 25-minute session. We have a belt wrapped around his pelvis. We have another belt wrapped around underneath his rib cage. He's locked in with the arm bolsters, and the table and the belt is locked into the top of the table. This piece will very gently distract the spine, but it pulls and it releases. It pulls and it releases. Much different than an inversion table. Inversion is traction. Decompression creates a vacuum effect inside the disc. The goal of decompression is not to stretch you apart like a Viking, but the goal of decompression is to fix the pumping mechanism that hydrates the disc. So when we create a vacuum effect, it draws fluid into the disc, helping the disc rehydrate. Patients feel well, they fall asleep on the table, it's painless, it's drugless, there's no needles, there's no surgery. Very comfortable. I'm going to ask my patient, Mike, how comfortable are you on the table?
It's very comfortable.
Great.
No pain at all.
In addition to the decompression session that Mike had today, we have two lasers, two smart lasers, Microlight 830s. There's a cold laser therapy. And basically what the laser does, it acts as a magnet to blood and it acts as a sealer. So it helps bring new oxygen into the area, new nutrition, flushes out inflammation, speeds up the recovery time, reduces pain, and helps the patient heal. So I'm with my patient Mike. We just did a round of decompression. We've done the decompression quite a bit already on you. What was your initial symptoms before we started doing decompression on you?
I just had constant lower back pain. Would be stiff when I would sit for long periods of time.
Right.
So.
And what were you trying prior to doing spinal decompression?
I was, just heat, ice, whatever would help other than surgery.
Right, so the last thing you want to do is to have surgery. So we have two decompression tables in the office. I have the AccuSpiner and the IntelliTrack. We've used both tables on you. And spinal decompression, is it painful at all?
It's not at all. It's a painless procedure. You're quite relaxed on the table, and it's just a light tug on your waist.
Would you recommend spinal decompression, non-invasive spinal decompression, for somebody that's suffering from low back pain prior to them having epidurals, opioid medications, or surgery?
Without a doubt, I would recommend it. I actually had a friend who was a surgeon, and he said to never get back surgery. So that's like the last resort.
It is the last resort, and some people do need back surgery, but if we can prevent somebody from having back surgery and the complications that come with that, sometimes, even though sometimes the surgery could be perfect, everything went perfect, what happens is scar tissue and adhesions down the road, and then sometimes patients also get side effects through the analgesics, the pain medication, and things of that nature. Activities of daily living, ADLs. Your back pain was preventing you from doing what?
It was more of something that was a nagging, or is a constant nagging thing going on in my lower back. And there was not really much relief that I could find in other things that I tried to do. And when I started doing the decompression with Scott, it got further and further away, the pain.
So you're able to do things now that you were?
Yeah.
Okay.
Yeah.
So I know that you're going away, and I've asked you not to play volleyball because I know that can injure you. So hopefully you'll heed my advice. We also made orthotics for you, I believe, because you're on your feet a lot and you've had knee pain. Have they helped you at all?
Without a doubt. I wear them constantly. I'm on my feet a lot at work. I wear them basically whenever I'm up on my feet. I wear the orthotics, whether I'm exercising at work or just even in dress shoes when I'm out at night.
We have two pairs or three pairs?
I have two pairs.
All right, so we have two full-length pairs, I believe, or one
Yeah.
3/4. But anyway, we were in orthotics all the time like I am because they prevent injury to your spine. They level your spine. So between the decompression, the orthotics, using the ice, some key target nutrients, we have a really very positive outcome in reducing your pain and allowing you to live your life pain-free.
I think in the final analysis, this has enabled me to still enjoy a quality of life and do the things that I've been doing my whole life and enjoyed, other than working.